Good morning, friends. Today we are going to perform a speaking role play. This role play we are dedicating to our beloved mentor, Father Saleen Joseph. I am Bharathi. I am going to act as an interlocutor and I will take up the role of a patient.
Good morning. I am Anith. I am acting as candidate. I will take up the role of a nurse.
This is recording for the Occupational English Test. The test is held in Edu Skills International on 7th May 2026. The candidate name is Anitha Taj and the candidate number is 1321. The interlocutor name is Bharathi M and the interlocutor number is 2131. The role play number is 1 and the profession is nursing. Role play time is approximately 20 minutes. The entire speaking will be recorded. There will be a ID checking. Then a warm-up session. There are 2 role plays. Each role play has 3 minutes preparation. Tips to deal with speaking subtests. The first one is read the role play setting properly. Means we need to focus person, place, time, background, etc. Then understand the concept or subject. Means we need to focus. The role play is talking about any disease condition or any procedure. We need to understand that and we need to underline main verbs. Then don't stick on to the role play. Focus on the patient concerns and give response depending upon the patient concerns. Then never forget to summarize the main points. OET test your communication skills, not your medical knowledge. OET assessment has 2 criteria. One is linguistic criteria, the another one is clinical communication criteria. Under linguistic criteria, we have intelligibility, fluency, appropriateness of language, resources of grammar and expression. Under clinical communication criteria, we have relationship building, understanding and incorporating the patient perspective, providing structure, information gathering, and information giving. Do's and don'ts in speaking subtest. Do's are be confident, be natural in tone, give response to the patient while listening by saying, okay, I got it, wonderful, fantastic, it's okay, like that. Those words we can use while listening to the patient. Make small notes during your preparation time. Ask for patient name while you are doing your preparation. Use proper noun and pronoun while speaking. Initiate the role play. Don'ts are don't be judgmental, don't force the patient, don't go out of topic, don't talk continuously, give chance to patient, don't use medical jargons, try layman's terms only. Now we'll start the communication. Good morning. My name is Bharathi. Can you state your full name, please?
Good morning. My name is Anith.
Great. You are taking test for nursing. Am I right?
Yes, that's right.
Great. Thank you. Can I see your identification, please?
Yes, here it is.
Okay. So please confirm your details are correct on the test paper. Then read and sign the candidate declaration on the front of the booklet.
Okay, it's correct.
Now I will ask you a few warm-up questions to familiarize each other voices. It won't affect your score in any way. Is it okay for you?
Yes, that's fine.
Okay. The first question, what are the current trends in nursing?
Well, nursing is a dynamic profession and changes are happening on daily basis. Nowadays, technology plays a vital role in my profession. For instance, paper records, what we were used in the older days, have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for each and every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Tell me about difficult situation which normally face in nursing.
We nurses face lots of difficult situations. As a nurse, I face a lot of difficult situations. However, the most difficult situation is breaking the sad news to the patient's relatives and their loved ones.
Okay, being a nurse, what advice you like to give to the upcoming nurses?
As a nurse, definitely I can give a bunch of advices to the upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can put their responsibilities in an efficient manner without any complaints. Besides, I advise them to be dedicated to their profession and maintain the professional standards. These are very essential because a nurse should abide with nursing ethics in any grounds. These are a few advices that I like to give to future nurses.
Now let's start the role play. I will take the role of a patient or perhaps as a relative. You will take your professional role. So each role play will last for 5 minutes. The purpose of the role play is to take evidence of your ability to communicate effectively with the patient. Use your ability to fulfill as much as possible. Do you have any question to me?
No, nothing. Thank you.
Okay. So you have up to 3 minutes to prepare the role play. You will start the role play after that time. You will know when 3 minutes are up. You can ask me anything you're not sure about. Make notes on the role play card if you want. There is a pencil for making notes. This is your information for the test. You can look at the card during the test, but must return to me at the end of the role play. Role play one for the profession of nursing. The role play will last for up to 5 minutes. Don't worry if I stop you if the time is up. Your
Okay.
preparation time starts now.
How can I address you during the role play?
You can call me Mary.
Okay.
Can you start the role play now?
Good morning, Mary. I'm your attending nurse Anita here. How are you doing?
Good morning, nurse. Yeah, I'm doing good. Thank you, nurse, for asking me.
Well, Mary, I'm here to discuss with you about your discharge. Are you ready?
Yes, nurse. Nurse, I think it's too early for me to get discharged. I'm so much worried about my care and support after my discharge, nurse.
I completely understand your concern, Mary, but I would like to know the support you have at home on regular basis until you regain your independence.
Yes,
Can you?
nurse, I have a son living with me, but once he's gone for work, I will be alone. This is my main concern, nurse. Please try to understand my situation, no?
All right, Mary, I understand your situation well. Don't worry, we'll support you to manage that situation. Okay? Do you have any other concerns about going home?
I'm really afraid of walking around independently, especially falling over in the shower. Honestly speaking, nurse, I'm not ready to go home, nurse.
I totally agree with you, Mary. The physiotherapist will teach you and your family about your mobility. I assure you that will help you to prevent from falling and you will be more confident to do your daily activities. Is that fine, Mary?
Is it so, nurse? Thank you, nurse. It's made me feel more comfortable and relaxed. Thank you once again. And by the way, nurse, could you please tell me when I will get my medication and how will I get my medication, especially for the pain relief?
Mary, your concern is reasonable. Before you go home, once the discharge summary is ready, the pharmacist will guide you regarding when and how to take your medication. Is that okay, Mary?
Yes, nurse. Thank you, nurse, for the information. Nurse, I'm also worried about looking after the wound area on my hip.
No, Mary, your concerns are understandable, Mary. Regarding your wound, I would like to advise you to check your wound for any signs of infection, such as pain, leakage from your wound, and any fever. If you notice any of these problems, kindly make an appointment with your doctor, and he will check the wound and redress and give medications if necessary.
Thank you, nurse. I understand whatever you explained to me. So kind of you, nurse.
Thank you, Mary. Do you need any more clarification from me?
Thank you, nurse, for your consideration. I have one more doubt about my wound healing. Could you please tell me how long it will take for the complete healing of the wound?
I'm so happy that you asked me your doubt, Mary. Thanks for asking such a question about your wound healing. I can say that usually it takes 3 to 6 months for healing. I hope you got an idea about that.
Yes, nurse. Now I have better understanding about my condition. Thank you so much, nurse.
Mary, I hope I have cleared all your doubts.
Yes, nurse. Thank you. Thank you so much. You cleared all my doubts, and now I'm ready to go home, nurse.
Mary, I'm glad to hear that. You are ready for discharge and I wish you a faster recovery.
Thank you, nurse. This is the end of the role play. Thank you, everyone, for listening to us. Thank you so much.